Deputy Secretary.
Well, let's start that again with my mic unmuted. Good afternoon, and thank you for joining us today. As of today, we have administered 578,335 doses of COVID-19 vaccine here in Wisconsin, and 107,860 of those were second doses, which means that 107,860 Wisconsinites have completed their vaccine series. I want to take a moment to talk about our data. Ever since the CDC started publishing vaccination data by state, the Wisconsin data reported by CDC has lagged behind our own data. And between the multiple day delays and the fact that our Wisconsin data page accounts for the long-term care pharmacy program differently, comparing the two is like comparing apples to oranges. For example, today CDC reports that we have administered 513,385 doses and 8,817 doses per 100,000 people. And as I just said, we have reported 578,335, not 513,000. And that computes to 9,971 doses per 100,000 people, or over 1,000 people more per 100,000 than CDC reports. We have been working with the CDC to increase the accuracy of their data reporting, and the discrepancies that we have collectively identified will be addressed both retroactively and going forward. We anticipate this will happen within the next week or so, and we're glad that the work here in Wisconsin will be getting better recognition. But let me just reiterate that the best place for accurate, up-to-date information on vaccine administration in Wisconsin is the DHS data page. Our Wisconsin vaccination effort is a monumental undertaking. And as a public health measure, it is the most significant intervention our state has ever seen. And as a tool to stop the spread of the pandemic, the vaccine has the potential to be transformative. As a logistical challenge, it involves collaboration between state, local, tribal, and federal governments, and cooperation across public and private sectors. To achieve our goal of 80% vaccine coverage for adults in Wisconsin, we need three things: public demand for the vaccine, the system or infrastructure to deliver it, and vaccine supply. Here in Wisconsin, we have built the infrastructure needed to make our vaccination effort a success. We know we have the network of vaccinators we need, because last week they requested nearly 300,000 vaccines to vaccinate the residents of Wisconsin who are eligible and who want a vaccine. But we could only fulfill about 27% of their requests. We need more vaccine, and we need a lot more. And when we do have more, it is clear we have a system of providers to deliver the vaccine. And it is clear that we have public demand for the vaccine, as our vaccinators reported over 200,000 vaccines given last week. So as we use the supply that we have and wait for production to increase and for more vaccines to be approved, we will continue to match this limited vaccine with vaccinators who can provide it to those most at risk of exposure, disease, and death from COVID-19. You know, waiting is difficult, not only because we know the vaccine is most effective when as many people as possible get it, but also because we have seen the relief across our state from Wisconsinites who have received it. Earlier in the vaccine process, we shared stories about the deep gratitude our frontline healthcare workers felt when they were able to take action to protect themselves by getting the vaccine. We are still hearing those stories across our state, but now from grandchildren crying when they hear the news that their grandmas and grandpas have received their first doses, and our firefighters celebrating their vaccinations with smiling photos on social media. I know we talk a lot about the challenges we face with the vaccine and how we need more of it, but I don't want that to overshadow the excitement and relief felt in our state. We have a safe and effective COVID-19 vaccine. We have a system to administer it, and people are getting it to protect themselves and their community. That is a cause for celebration and for gratitude. And let me conclude by reminding us all that even as we increase vaccination rates, COVID-19 remains at high levels in our state, and so we must continue to practice prevention. Wear your mask, social distance, and wash your hands. Thank you, and with that, I'll turn it back to Elizabeth, and Dr. Schauer and I look forward to answering your questions.
Thank you, and we will now take your questions. A reminder to maintain audio quality. Please remain muted until it's time to ask your question. If you're on the phone and you are able to do so, use *6 to mute and unmute. And we begin with Katrina Nickel at Fox 11 in Green Bay. Katrina.
Hi there, thanks for taking my question. My question this afternoon is that there are claims from rural counties, specifically one from Green Lake County that we received from their health officer that their vaccine supply is being shortened to help supply more of those urban clinics that are opening. Can you just touch on why this is happening and what the state is doing to address it?
Yeah, well, as I said earlier, we have a terribly difficult situation with nearly 300,000 doses requested and only 27% that we could provide. So those are first doses. So nearly 300,000 requested. We were only able to supply 77,760 last week. So our formula takes into account a number of different factors. And this week, we made some changes to assure that we were equitably distributing the vaccine across our state. And so we made sure that everyone who was vaccinating in the long-term care program that we're helping out CVS and Walgreens to get to our assisted living facilities received their full supply. We made sure that our federally qualified health centers and our tribal clinics received their full supply. We gave preference to local health departments. We also did maintain at least 2,000 doses going to high throughput vaccinators because we wanted to be sure the vaccine was moving quickly into the arms of people. So some of those larger systems that had shown us they could give vaccine quickly continued to receive 2,000. May I please point out they wanted 20,000 and they got 2,000, so they are not happy either. And we made every attempt that every county that requested vaccine received vaccine. We did limit vaccine distribution to those who requested less than 50 doses because of trying to center it in places that could get vaccine out, and also because it's very difficult for us to make that many deliveries for very small quantities of vaccine. So we continue to encourage our rural partners to request vaccine. We, as I said, worked very hard to get vaccine to every county that requested it. And we're going to have to alter back and forth between places in the weeks to come as we continue to have relatively small supply for the number of requests that we are getting. But we will continue to review our allocations and do our very best to assure equitable distribution.
Thank you. Next question to Eric Gunn, Wisconsin Examiner. Eric Gunn.
Hi, thank you for taking the question. The CDC reported yesterday that 62% of nursing home workers nationally have refused the COVID-19 vaccine. So I have a multi-part question from that. What's been the refusal rate of the vaccine by nursing home workers in Wisconsin? And the reason for that, or if we're an exception to what they are showing, why is that? Also, are there broader demographic trends or correlations among the healthcare workers refusing the vaccine? And that leads to the question of, does the state have ethnic and racial demographic breakdowns on who is getting the vaccine generally, including percentage of population, the way you do a report on gender? Thank you.
Well, I'll talk about the race and ethnicity data, and then I'll turn to Dr. Schauer for her thoughts on the remainder of your questions, Eric. We are getting ready to publish race and ethnicity data. We have not yet done so. We're still working on cleaning the data and also making sure the data is representative of a broader population. And, you know, as I mentioned during the briefing last week, much of our demographic data to date has been largely reflective of our first population, Group 1A, which was largely healthcare workers and residents of long-term care facilities. So now as we move into a much broader population, people over age 65, our demographic breakdowns by age, by gender, and by race and ethnicity will start to be a bit more representative of the population as a whole. So let me stop there and then turn to Dr. Schauer with any thoughts she has about the vaccination of healthcare workers in long-term care.
Yeah, thank you. So between the skilled nursing facilities and the assisted living facilities that are part of that pharmacy partnership program, nearly 24,000 staff members have received a first dose, and we anticipate that that will continue. As folks remember, the assisted living is underway. The skilled nursing have finished their first dose rounds, and they will be and have started on their second dose clinics. And the assisted living, we've done about 21% of those that are enrolled in the program. I think it's important to remember that these visits will include a series of 3 times that the pharmacy will be going. And I think what you'll see is there certainly are individuals who are early adopters and are stepping up at that first clinic. But there's also a number of folks who are in this, what we call the movable middle, and folks who may have questions or actually find that they may be more willing to be vaccinated once they've seen individuals who they know have been vaccinated and see their experience with it. They just need a little bit more time. So as we move forward, we hope that more individuals at that second and at that third clinic will step up if they didn't already at the first. So I think that's one of the things that they are starting to see, that some of the predictors around individuals receiving vaccine is when they have questions, is that experience of either having a healthcare provider, their own healthcare provider, make that recommendation, or knowing someone who's been vaccinated. And as we move forward, that number will get bigger, and we hope that that will help encourage and reassure individuals who said, not me first, but maybe second or third.
All right, thank you so much for that. Let's go now to Sean Gallagher at TMJ4 in Milwaukee. Sean Gallagher.
Yeah, thank you. So we've had a number of folks, African Americans in our area, with very high concerns about any disparities that exist. We've seen from the Milwaukee County numbers that there is a large disparity there, and some elderly folk who do fit into the category to be vaccinated, they've been waiting 2+ weeks and haven't heard back about any sort of timeline. They're not really getting any information about when they could potentially get a vaccine, and then they do have concerns about even waiting for these vaccines in lines when they are in that elderly population. What's being done to kind of help assist these communities that have historically been left behind? What's being done to prevent that from happening here?
Yeah, great question, Sean. So again, we're just getting started in a rollout of over 700,000 people, 70,000 doses a week. So one of the things you heard me mention is We know our federally qualified health centers are providers of care to many of our African American and Hispanic communities. And so one of the things we did this week is make sure that every one of those clinics received their full allotment of vaccine to be sure that we were getting vaccine to providers who specifically serve these populations. In addition, we also are making sure we're getting vaccine to free clinics, voluntary free clinics this week as well. We also are working, healthcare systems are working to reach out to their patients. And we know that there may be patients, they may be African American patients, they may be Hispanic, they may be Hmong, they may be Caucasian, who maybe don't use MyChart or don't use electronics in the same way that many of us on this call do, since we're all already on Zoom together. And so we are looking at ways we can work with community-based organizations to reach out to people. I had the opportunity to speak with the commissioner of the city of Milwaukee, or the acting commissioner of the city of Milwaukee Health Department, talking about work they're doing, reaching out through African American churches and other organizations to provide information. And so I think it's fair to say we will never have done enough, and we are recognizing this issue and working on ways that we can increase both access to vaccine and increase information to populations who have great need as we move forward.
Thank you for that. Next question to Scott Bauer at the Associated Press. Scott Bauer.
Hi, thanks again for doing this call. Julie, could you address whether the state has gotten any indication about whether the vaccine supply number will be increasing, and if so, when? I think you had said last week you thought for the next 3 weeks or so we'd still be around that 70,000 dose per week number. Just wondering if you had an update on that.
Yep. Thanks, Scott. What we have not seen it in Tiberius yet, which is the mega data system where our vaccine numbers are predicted. What we have been told is that we saw about an 18% bump in our Moderna allocation last week. Excuse me, we saw an 18% bump in our total allocation. Almost all of it came in Moderna. So we saw we're getting about 35,000 doses of Moderna. We're now getting about 48,000 doses of Moderna a week. So when you look at that as a percentage of the 70,000 combined of Pfizer and Moderna, it's about an 18% total bump. So we did see that last week. And we've been told we should anticipate that for the next 2 weeks. So I want to caution people, though, it's a little complicated when we look at the allocation, because we are still paying Moderna doses to the pharmacy program. So we still have a debt to that program. And we also, our total first dose allocation is sometimes reduced by how we have to balance our first and second dose allocations all week. So there's still some fluctuation. It is good. We've seen that 12,000 dose increase in Moderna, and we have been assured by the federal government that that is where we'll remain likely for the next 3 weeks. So small increase, haven't seen it in the official data system yet, but we are assured it is coming hopefully today, and we'll continue to move every dose that we can out to our vaccinators.
Thank you. The next question to Sean Kirkby at Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. Was wondering, as the vaccine gets rolled out across the state, have you guys seen any other cases of the more contagious COVID-19 variants or any other variants appear in the state yet? Thank you.
Not to my knowledge, Sean, and I was speaking with our Director of Bureau of Communicable Diseases this morning. As of this morning, we had only identified the one case through genomic sequencing. We have put out communication to our clinicians across the state for whom to be particularly vigilant about testing, asking for that additional genomic sequencing, particularly people who have traveled recently or who have been contacts to people who have traveled recently. So our state lab is one of the best in the nation in genomic sequencing. And so I'm really grateful for the resources we have here to be detecting those variants. But I think your question raises a really important point. We don't know what's going to happen next. And many epidemiologists across the nation are suggesting we need to not rest on our laurels, that these variants can catch fire very, very quickly. And so while we're making great progress in vaccine, we're nowhere near herd immunity yet. And we all, especially with these variants in place in the nation, need to assume they are or will be in Wisconsin soon, and we need to be as vigilant as ever in our preventive actions to stop the spread.
Thank you for that. The next question now, we go to David Wahlberg at the Wisconsin State Journal. David Wahlberg.
Yeah, thank you. Based on the uptake you've had of the vaccine so far and the slight increase in supply that you just mentioned, do you still see the teachers and other additional phase 1B groups starting on March 1st, or do you see that potentially moving forward or back further?
Yeah, that's an important point we're having discussions about right now, especially with our vaccinating community, and we'll have more on that soon for you, David. I think we're making great progress, but as you've heard from the other questions, there are still populations who haven't heard anything, who are in the 65 plus population. There are lots more people to receive vaccine in this group, and so we'll need to be thinking about where we are in terms of supply and what we're hearing about early March. As I said, we have a 3-week commitment from the federal government, so let's see where we are in mid-February and make further decisions from there. But, as we've said to everyone in phase 1B, it was a tentative start date, and I need to emphasize that it is still tentative.
Thank you for that. The next question to Will Cushman at WisContext. Will Cushman.
Good afternoon. I am just looking at the data right now. I think my math is correct. It looks like there are about a little over 200,000 doses administered in the last week, and it appears that about 30,000 of those were second doses, which would leave a difference of about 174,000 first doses administered in the last week. And so that's clearly quite a bit higher than the 70,000 doses per week that we've been talking about. And I'm wondering what factors you think might be explaining that increase, whether it sounds like there partly could be due to a little bit of an increase in our allocation, but then I'm wondering what the impact of broadening eligibility for vaccines may have had, as well as taking back doses from the pharmacy partnership program with CVS and Walgreens. And then related to that, do you expect this kind of higher number of doses that we have seen administered last week to remain the case over the coming weeks? Thank you.
So Will, I'll say a couple of things. I'll see if Dr. Schauer has things to add. I think there's a couple of things that mean we were able to give more doses last week. First of all, remember what we were giving last week is what we distributed largely that week and the week before. So this increased number of doses isn't hitting until this week. So let's be clear about that. But what we did do in the prior week was we cleared out, we had a few extra doses in our hubs. We had a few extra doses we could order that we hadn't yet ordered from the federal government from prior weeks where we hadn't had as high a demand. So I absolutely do think the broadening of the population caused our vaccinators to ask for more vaccine, and we got it to them. So We distributed 116,000 doses in the prior week versus the 77 we're doing this week from gathering up those different elements, and as you said, also withholding a week's payment from the pharmacy program. So we had higher allocations last week to our vaccinators, and we also knew there was vaccine in inventory. And I'd like Dr. Schauer to talk a little bit about the work we've done with our vaccinators about moving vaccine in inventory.
Yeah, so we have been working with vaccinators and using information that they're required to report their current inventory, so their daily inventory as to what's on hand. And so we've been doing a lot of outreach to determine with groups that may have more than anticipated to see if we can provide education to help figure out their plans. And I think what we're hearing is some education was needed in terms of making sure that that information was correct. So that's good. And using the system so we can really appropriately monitor that. But also we heard that they've got clinics scheduled, and it is a tight time frame from the time that they know how much vaccine they have to scheduling clinics. And I think so some of them are finally getting into a cadence where they are able to provide vaccine. I think the other piece I'd like to add to this is that the 65 and older age group in general is actively seeking vaccine. When you look at influenza vaccination rates, and this year has been no exception, that the individuals who are 65 and older have the highest percentage of uptake for flu vaccine. They're nearly at 75%. Compared to overall, when you look at Wisconsin, we're at 42% uptake for influenza. So you have a highly motivated group that is out and seeking vaccine. And so I think that makes the vaccinators' job a bit easier when they've got so many people who are eligible and willing to receive vaccine. And that I think we will continue to see.
Wonderful. Thank you for that. Next question to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Yeah, hey, thanks for taking my question. I was curious. You had mentioned the 80% number before in terms of, you'd like to see 80% of the population vaccinated. At what point, at what percentage do you think we could start seeing a reflection in the COVID-19 infection data from the number of people getting vaccinated? At what point are we going to see that making a difference? Thank you so much.
Yeah, Rob, I wish I could tell you that. And the challenge with that, especially today, is what I was referencing earlier. With the variants, the variants of the virus in place, it's very hard to predict that. Because all it will take, and we can continue to see our vaccine rate rising, but if we get one of these highly transmissible variants in our state, we could see a surge even with a vaccination rate in the 30, 40, 50%. So it's just not as simple a calculation as it might seem, especially with these new variants of COVID-19. And just as a reminder, the issue with them is that they are much more highly transmissible, which makes the spread much quicker. And the more COVID-19 spreads, the more likely it is to spread to people who are highly susceptible to it, which will result in higher levels of hospitalization and unfortunately higher levels of death. Not everybody, of course, will experience those consequences of an infection, but as we saw in the fall, when lots and lots and lots of people with mild disease get infected, it also has an effect on many people who experience more serious disease and results in hospitalization. So in the end, it's really a balancing between seeing the infection rate come down, not just from vaccine, but from control of the infection through other mechanisms until we achieve those higher levels of 75, 80% of coverage. And so that is why we're really saying we think we need to practice preventive measures until we start to get very close to those levels. Dr. Schauer, anything you would add to that?
No, thank you.
Thank you. Now to Madeline Anderson at Fox 6 in Milwaukee. Madeline.
So just following up on the question about the state being able to administer 200,000 doses last week, is that more of an outlier in the data? Like, should we expect the weekly number of doses to go back down to the 100,000 mark this week and in the, in the coming weeks until we start getting more than 70,000 doses? Or can we expect to stay at this 200,000 level? Thank you.
Well, we're going to stay above 100,000, I would predict, because one of the things I want to remind people is when we keep talking about the 70,000 or the 77,000 doses, those are first doses. So remember, we're also having the second doses, often called the booster doses, coming into the state. And so all but, we've administered vaccine now to 578,000 people, and 107,000 of them are second doses. That means we still have 470,000 people coming due in the next few weeks who need their second dose. So, and those second doses automatically come from the federal government on a cadence based on when the first doses were sent. So we'll continue to see high rates of vaccination. It's just you'll see some variation perhaps in the balance between the second doses and the first doses.
Thank you for that. The next question to Adam Rogan at Racing Journal Times. Adam Rogan.
There's something you mentioned earlier that I was curious about, Julie, and that you said that it's so difficult to balance who gets doses on a given week, and you're going to try to kind of go back and forth with who gets it one week and who gets cut the next with different vaccinators. Would it be a fair characterization to say that it's impossible to have a perfectly balanced rollout right now, or what do you kind of respond to that issue of how difficult it is to balance all of this?
Yeah, I think what we're trying to do is we're trying to learn each week as we go, and we're fine-tuning the system and adapting it as we go. I can tell you on Friday, when we sent out the allocations to our vaccinators, probably almost no one was happy. I mean, you can imagine if you only have 27% of what you need to give people. People are going to be deeply disappointed because our vaccinators want to get these vaccines in the arms of people who so desperately want it. And so it is a challenging balancing act. I think one of the things that will help is when we have a little bit more supply, and is how we can get more vaccine to our smaller vaccinators. Just to give you a sense of the logistical challenge there. If, for example, a pharmacy or a small clinic can give 25 or 30 vaccines a week, the smallest amount of Moderna vaccine that we can ship them is 100 doses. So we could ship 100 doses to that small pharmacy, but now 75 doses are going to be sitting on the shelf for the next, if they can only do 25 a week, for the first week, and then 50 for the second week. And so in the spirit of trying to get vaccine as quickly as we can to people, we're saying to people, we want you to be able to give 100 doses a week, or we can bring smaller amounts of Pfizer vaccine to them from our hubs, but we can only make so many deliveries in a week. And so that's what the challenge is with these smaller vaccinators. But that's where I think, we have some work to do to look at how we balance things out for them, because we also know many of those smaller vaccinators are really critical in rural communities. And we also know they're very critical in communities of color, as we were discussing earlier. And so that's where I think our balancing as we move forward is really important as we think about how we get both vaccines to those who can give it quickly and vaccines to those who can get to populations in most need who may be neglected otherwise. Dr. Schauer, anything on this that you would add?
Yeah, I guess I would just add that the Pfizer vaccine still has the significant storage and handling challenges. So as we are transporting out to those smaller locations, the clock is ticking. That vaccine generally comes out and goes into is in a refrigerated state and has to be used fairly quickly. So they have to be ready and being able to use that in a short period of time. And so we're getting better and we're learning more about this and going forward, but we do look forward to a day where we have vaccines that aren't so finicky and have a little less stringent storage and handling requirements.
Thank you both for that. Next question to Stephanie Hoff at WisPolitics. Stephanie.
Good afternoon. Thanks for taking my call today. I'm just wondering why there was a pause with the Vaccine Advisory Committee meeting. Thank you.
So, Stephanie, I think as you've seen, it's going to take us a long time to get through the current populations we're vaccinating and the groups in phase 1B. And we also are having regular conversations with the Biden administration about priority groups for vaccination and anticipating the new administration may have some counsel around how a vaccine is staged. And so in the spirit of not wanting to duplicate work, if we're looking to the federal government for further guidance on that and knowing we have a long time before we're going to be ready to move to the next phase, we asked the group to pause their work for right now. You notice the word pause, not end, pending further guidance from the new federal administration.
Thank you for that. Next question to Sanika Bargaw, WMTV Madison. Sanika.
Hi, can everybody hear me?
Yeah, yes, go ahead.
Great. I actually have a question slightly not as quite related to vaccines, but we were also hearing questions from viewers, not just about vaccines, but also about this sort of recommendation from Dr. Fauci about double masking, and we wanted to see what our local state health officials had to say on that subject.
Sure. So when you think about masks, there are two things that really affect how effective a mask is, and that is how tightly it fits around your face and also the material that it's made from, how much it prevents small-sized particles from getting either from the person wearing the mask out or from others in. And so we know the best masks are N95 masks that do both the filtration part really well, and because they go, the people who wear them go through a process called fit testing, which makes sure the seal around their face is perfect, they're the most effective, followed by surgical masks that are worn in healthcare settings, followed by cloth masks. And cloth masks vary greatly. We know that multiple layers of cloth are helpful with cloth masks. They make them better at the filtration. We also know the tighter they fit, if they have, something that fits around the nose, makes them more effective. So the recommendation around 2 masks that you've heard from Dr. Fauci is largely linked to the concern around these new variants that are much easily spreadable. And so the idea is not knowing, if you've got a cloth mask, wearing 2 is definitely going to help with that filtration because you'll add extra layers. And just having done it myself, I can tell you it makes the fit tighter too, because when you've got 2 on, it's just held closer to your face. So that is good practice for people who are out and about. Wearing 2 masks is certainly better than wearing 1 mask. And given the state of not knowing exactly where we are with variants, it certainly doesn't harm people in any way to make that choice of 2 masks.
Thank you for that. Next question to Brittany Schmidt, WBAY in Green Bay. Brittany.
Hi, so Door County Public Health recently put out a statement today saying that they actually stopped taking appointments because every week they've been forced to cancel hundreds of appointments because, as you said, they're only receiving about 27–30% of what they're asking for. So are we now seeing the ripple effect of not enough vaccine where these clinics that are all set up ready to go are just not being able to have enough? We have a ton of vaccinators, low vaccine. So what should these places do? I mean, they're not even taking future appointments right now until they know exactly what they get. I know that some people are canceled on week after week after week.
Yeah. So many vaccinators are putting together waiting lists. And so if they have to cancel an appointment, they put people on a waiting list for when they find out each week how many vaccines they're receiving. They can call them back and offer them appointments again. You are right. We have more vaccinators. We have a more robust system than we have vaccines. And that's why I know it sometimes feels like a broken record to hear us saying over and over again, we need more vaccine, we need more vaccine. We have people who want it. We have vaccinators ready to give it. But that is the bottom line, is we need more vaccine. What we are saying to our vaccinators, and you know, it's Door County Public Health, it's health systems who are calling me, calling our department on Friday night and saying, I've got capacity to give 20,000 vaccines a week. Every health department, every pharmacy, every health system calls us and says, we have more capacity than you're sending us vaccine. And so what I think we all need to keep our eye on is there is going to be a day where we will have more vaccine. It is likely to grow a little bit by a little bit by a little bit by a little bit, maybe with a few jumps when we get new vaccines added into the mix. So it is fabulous that this state has vaccinators ready to vaccinate. And again, just as we say patience with our public who want the vaccine, we're asking our vaccinators to keep their systems in place, vaccinate who they can. If they're looking at how they might conduct a mass community clinic, think about how you would do it for a day versus 5 days a week, or think about how you might perfect your process using one line versus a day you might be able to run 10 or 12 lines. So our vaccinators getting in the groove, practicing with the systems they have in place, with the vaccine that is available, will continue to move the doses we have forward at this point in time. Remember, every 100,000, 200,000 people we vaccinate now are people who will be complete and not be in line later when we get more vaccine. So it's the story of slow and steady progress right now. We're grateful to our vaccinators who have set up their systems, and they will adapt them as they have very low supply right now. And grateful to our public for their patience, and just celebrate how we'll be ready to move quickly as we get more vaccine.
Thank you. The next question to Chuck Kornbach, WUWM Milwaukee. Chuck.
Good afternoon. A Milwaukee Health Department official yesterday, Dr. Tamaro, said they were doing greater screening because of who was getting into the Wisconsin Center, because the Healthy MKE site had been shared on Facebook. There was an attempt apparently to get people younger than 65 into the clinic. How common is this? Do you hear that there's been pushes to try to get people that aren't qualified quite yet into these sites?
Well, Chuck, I haven't heard lots of that specific situation, but I'm not surprised. Lots of people want vaccine. I suspect everybody on this call would like a vaccine soon, and most of us are going to be waiting for a while. And what I would just say to everyone is we will have vaccine, but it's going to take some time. If you listen to our federal partners, they are suggesting, you know, it is likely to be late spring, early summer before vaccine supply is large enough for everyone to be receiving vaccine. And so there are ways to prevent COVID-19 other than vaccine. Many of us have been doing them for a whole year, and I know we're weary of it, but I encourage people who are not in a current eligible group to continue following preventive measures like wearing your mask or masks, socially distancing, keeping your social circles small, and we will get there. Late spring, early summer may feel like a long time away right now, but think of it in the context of what we've already been through, and it certainly looks like a light at the end of the tunnel. The second thing I'd say is I applaud the City of Milwaukee Health Department for being aware of this and for their due diligence to continue to do additional screening. We have asked our vaccinators to abide by the eligible populations, and we are deeply appreciative to vaccinators like the City of Milwaukee who are doing everything in their power to make sure they're vaccinating those who are in the current eligibility groups.
Thank you for that. Next question to Mary Spacuzza, USA Today Network, Wisconsin. Mary.
Thanks for taking my question. I know you said you're still working on the state's racial and ethnic vaccine data, but is there anything else you can share about what you're seeing so far and what's being done to address vaccine disparities in Wisconsin?
Dr. Schauer, would you like to say anything about the data so far, and then I can talk a little bit more about what's being done?
Yeah, I can just say that, you know, it is certainly something that we plan on putting forth. As you have noted that the number of doses administered has been increasing. We had a record recorded on, I believe, the 27th of January with over 46,000 doses being administered. So the volume is getting to a place where we will be able to provide some of that race and ethnicity data in the coming weeks. And so more information will be shared on our website with respect to that. You will notice that as we have moved into having opened it up to 65 and older, that you will start to see some of the age shifts. So we are seeing far more people moving towards that right-hand side of the column and being 65 and older. So we are starting to see with the volume of increase that there are some changes in the data, and we hope to be able to continue to share more of that information to guide efforts going forward.
And then in terms of efforts to make sure we're getting vaccine to populations that have been most deeply affected by this pandemic, we are, as I said, constantly reviewing our allocation formula and looking at ways to be sure we are getting vaccine to those vaccinators who are most likely to be providing easy access to these populations. We are working with our Medicaid program to be sure that HMOs and providers enrolled in the Medicaid program understand the priority here. And our, one of the things I became aware of today is in terms of transportation resources for vaccine, because we know that can be an issue for many populations whose incomes are limited, is that the transportation resources associated with Medicaid will now be, if you're getting a COVID vaccine, it's considered an urgent situation, so you can get back transportation that day without having to plan multiple days ahead of time. We are working with a number of other partners to think about how to do outreach with community-based organizations. Just like Dr. Schauer said earlier about healthcare workers, we know people are more likely to get vaccine when they know someone who has received vaccine and they receive that information from a trusted source versus necessarily from the government or just an advertisement somewhere. So we are working on grants to community-based organizations to do that outreach. We're doing that in partnership with other funding parties. We're working with local health departments on outreach as well. And we're thinking as we continue to build the vaccination system, what kinds of opportunities for specialized community-based clinics in communities of color or communities that may be more marginalized so that people can get ready access to the vaccine. So all of these, just like moving our vaccine to broader populations, moving our vaccine to special populations is going to be a process that will continue to develop as we continue to get vaccine supply over the coming months. So much more to come, but those are a sampling of the kinds of ways that we are reaching out to people of color and other groups that have been more deeply affected by COVID-19.
Thank you for that. The next question to Jessica Van Egeren, Up North News. Jessica.
Hi, this is Christina Leffering from Up North News. Jessica wasn't able to make it. So really quickly, why are people with underlying health issues, particularly those that are most at risk of getting really sick or dying if they contract COVID-19, why has that group not been prioritized in getting the vaccine?
Yep. So this is a matter of limited supply and more people who want and need the vaccine than we have vaccine for. And so the decision that we have made is that we're beginning with the most at-risk population being those who are over age 65. Many providers are also further factoring in, as they have limited supply, those who are over age 65 and have many of those other diseases that you mentioned. So if you're 80 and you have asthma and diabetes, your number may come up first from your healthcare provider than if you're 65 and perfectly healthy. So many, this is per the recommendations of the State Disaster Medical Advisory Committee, who made that recommendation. Within groups they've recommended that we consider both demographic factors that can put you at risk, like age, like race and ethnicity, and other diseases that put you at risk, like asthma, emphysema, heart disease, diabetes. So within each of the categories, we have encouraged vaccinators to consider those. And as we open up further, there will certainly be consideration for opening to other groups of younger people with those comorbidities.
Thank you for that. Next question now to Allison Broner of Spectrum News. Allison.
Thanks for doing this. We really appreciate it. Expanding on the question asked about educators, what is the plan to keep it fair when it comes to vaccinating our teachers? You know, we've talked with teachers who have received the injection. We talked with others who are still waiting and are concerned their district will start in-person learning before they get that opportunity to get vaccinated. What can you share with them?
Yeah, well, what I can share is I wish I had a vaccine for every single one of you. And it is unfortunate that some of our vaccinators did not follow our guidelines and did proceed with vaccinating teachers and created some haves and have-nots in our world here. But we are moving as quickly as we can, and clearly educators from early childhood through K-12 through our university system are a high priority to us and will be coming soon. So the good news is you are on the list and you will be coming. And the bad news is we just don't have enough vaccine yet. And we'll be working through our 65 and older population. Plus, let me be clear, finishing our healthcare workers too. We have not gotten through all of our unaffiliated healthcare workers. So that group is still on the tail end of completing their vaccinations as well. And teachers will be coming soon.
Thank you for that. And we are pushing our time limit, but we do have a handful of reporters. We want to try to get to everyone. So I am going to ask you to please limit your questions to just one question in the interest of time if you can. We go now to Victoria Saha, WAOW in Wausau. Victoria.
Hi, can you hear me okay?
We can hear you. Go ahead, please.
Okay, perfect. So my question was, we've been getting a lot of reports of a lot of people getting side effects after the second dose. Is this normal, and is this a good response that your body is reacting to the vaccine?
Great question for Dr. Schauer.
Yes, I mean, I think it's important to remember that after any vaccine that you do anticipate having some maybe redness or swelling around at the injection site. And sometimes there are some more significant reactions. And that's a sign that your body is actually responding and creating that immunity. And so it is important that individuals who are vaccinated are made aware of that. You know, some adults may not have received a vaccine in a couple of years, although we're hoping certainly that everyone is receiving flu vaccine, but it's good to remember that that is an expected part and that they should be counseled about when they should be concerned and to reach out to their doctor. Remember, it's important that vaccine safety and adverse event monitoring is important. And so, you know, participating in the VSafe program is really key. So they can go ahead and report those, and that gets cataloged to CDC. And certainly if there's anything concerning, they're contacted and follow-up is needed. So I think it's important to remember that that is a part of it. It certainly is better than you know, contracting the disease, but sometimes people may want to make a little bit of allowance for, and in anticipation that they might not feel their perfect best the following day after vaccination.
Thank you for that. Next question to Stella Porter, WSAW in Wausau. Stella.
Hi, thanks for taking my question. I'm wondering how this Microsoft signup is going to work and how that will kind of take the strain off of some of these health systems that are devoting a lot of resources to just scheduling right now.
So the Microsoft tool will primarily be used by community vaccinators, not by health systems. So, and what it will do is we'll promote it through our website, through the websites of community vaccinators who are using it. We'll be standing up a place on our website where you can see where the community vaccination sites are, and you'll be able to log into that site and again, provide your demographic information, answer some questions about your health and your eligibility, and then either be told you're eligible and be able to make an appointment, or be put on a waiting list if you are not yet eligible. We also, just in the spirit of equity that we've been discussing here today, we'll also have a call-in line. So it won't be, you have to be internet accessible and literate in order to use it. There also will be a call-in line that people who don't use the internet can call and follow the same process and be able to schedule.
Wonderful, thank you for that. Next question, Austin Montgomery, Beloit Daily News. Austin.
Hi, thanks for taking my call. Are there penalties for vaccine distribution to unauthorized groups, and have any sanctions been issued to health systems currently under contract with the state for receiving vaccine?
We have not chosen to issue sanctions on that. We call every health system or every vaccinator that we know is violating the policies and ask them to stop. If we become aware that they have not stopped, the consequence would be we could reduce their vaccine distribution.
Thank you for that. Next question to Emily Fannin at CBS 58. Emily.
Hi there. Thanks for doing this call. I wanted to go back to how you opened this briefing, Julie, talking about the CDC data. I know you said it's not as quite as accurate, but they do show Wisconsin is catching up, especially to Midwestern states, jumping from nearly last to now ranking 24th. So can you kind of just weigh in how and why the state is improving, and can you say that we are improving?
Oh, for sure we're improving, Emily. I promised you we would improve. We're improving. So, you know, when I looked at the data just before we got on this briefing, the data, I don't want to say the data is inaccurate. The data is old. It's dated. And so, you know, when I looked at what they had on the website, it was equal to about where we were on Friday, between Friday and Saturday. So, you know, it's 3 to 4 days old. So that's the problem. If our data is 3 to 4 days old and everybody else's data is a day old, I mean, there's always going to be a lag between a state and the federal government as you upload data. That's what has largely put us behind. But we have made great strides in our vaccination efforts over the last few weeks. The big credit goes to our vaccinators. And I think we did that both by opening up who they could vaccinate, by supporting them with as much vaccine as we could squeeze out of the system and they could squeeze out of their inventory. And we have done it through a population that is eager to get the vaccine. So as I said, it's a three-legged stool. We got public demand, we got a great infrastructure. We can do even better if we have adequate supply. But you're absolutely right. We are right up there in terms of doses per 100,000 with our Midwestern partners. We've given 68% of the doses we've distributed, which is also above the national average. And so we're on a roll. We're moving forward. We promised you we would, and we are there.
Thank you for that. Let's go now to Danny Maxwell, WKOW in Madison. Danny.
Hi, the Biden administration announced this morning direct shipments to retail pharmacies. Do we know if that will be coming to Wisconsin next week and who might be getting them?
I can start that off and see what Dr. Schauer has to add. Yes, we know they will be coming to Wisconsin. They'll be going to Walgreens stores. And let me turn to Dr. Schauer to see what further information she may have about the details of that.
Yeah, we are still awaiting that information. We anticipate that it's actually coming this afternoon. So more to come on that.
The information is.
The information.
Not the vaccines.
Correct. Correct. More information about where and how much is coming soon.
Thank you for that clarification.
If I can clarify, Elizabeth, our understanding is that that allocation will not be taken from the Wisconsin state allocation. There's a separate federal allocation for this pharmacy program. So these will be doses in addition to what our state is already receiving. So that will be good news when we find out how much and where.
Wonderful. Thank you so much. Let's go now to Amanda Quintana, WISC in Madison. Amanda.
Hi there. Just going back to the ethnicity data for a second. Some healthcare systems are prioritizing minority groups who have been most affected by the virus in that 65 and older group, but then, you know, some are not. Not all of them are doing this. Is DHS recommending prioritizing these groups, and when might we see this ethnicity data on the website?
Yeah, as I mentioned earlier, yes, we are, because we have said when you have not enough vaccine for all the people who want it, the SDMAC recommendations very clearly say prioritize thinking about demographic elements that put you more at risk, which certainly include race and ethnicity for COVID-19 and other comorbidities that put you at risk. So that recommendation is definitely out there from our State Disaster Medical Advisory Committee and through the Department of Health Services. I don't know the exact date when we'll be publishing the race and ethnicity data. Dr. Schauer, do you know? But I know it will be soon.
Thank you for that. Now to Chris Rios, CNN. Chris. A reminder, *6 will mute and unmute your phone. Chris, CNN. All right, let's move on to our final question. Sarah Volpenines from the Milwaukee Journal Sentinel. Sarah, are you on the call?
Hi, yes. Thank you for taking my question. My question is about the Pharmacy Partnership for Long-Term Care program. You said earlier, Julie, that the state is still paying doses into the program. How many first doses of the vaccine have actually been transferred from the state's allocations to the program? And how many has the state been taking out of its allocation each week?
So we have paid 126,800 doses into the program. We have canceled 35,000 doses because CVS and Walgreens have told us they do not need those doses, and we have another 35,000 that we still need to pay the program. And we are not paying those this week. We're going to see where the pharmacies are as they continue to move through the assisted living program, and we'll titrate that final payment based on their needs. Anything you'd add, Dr. Schauer? Did I get that right?
That is correct.
Yeah. Okay.
Wonderful. Thank you both so much. And with that, we are out of time. We're going to wrap up today's briefing. We want to thank Deputy Secretary Julie Willems Van Dyke, Dr. Stephanie Schauer, and of course, all of you for participating. We ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.